South Korea will start mass producing a blood plasma treatment for COVID-19 during this month of September, according to the Food and Drug Safety Ministry. Supplies are expected to be ready by next month. Now, antibody treatments are designed to mimic the body's natural response to an invasive virus and disable the threat. Now, will this be a promising way of treating COVID-19 when a vaccine may still be months away? Today, I'm joined by Dr. Stanley Perlman, Professor of Microbiology and Immunology at the University of Iowa. Hi, it's great to see you, sir.
Good to see you.
We also have Dr. Paul Sambanis, Adjunct Assistant Professor of Environmental and Occupational Health Sciences at the University of Illinois Chicago School of Public Health. Thanks for joining us this morning.
Thank you for having us.
Well, let's start with you, Dr. Perlman. Now, at this point, across the world, a growing number of reports are saying that a COVID-19 vaccine isn't going to immediately put an end to the crisis. So in that regard, how important is it to first develop a working treatment, even if there is an October surprise?
Yeah, well, I think it's always been important to have a treatment if we could find one, because people, when they get sick, a vaccine's not going to help them then. So we'd like treatments that both we could give early in the infection and maybe abort the whole thing, sort of like Tamiflu does with influenza infections, and then something that we can give to people who are sick in the hospital. So treatments, no matter what a vaccine does, are important, because people are going to either not get vaccinated, or the vaccine may not work, or they may be an age group like older people who may not respond to the vaccine so well. So treatments are, I think, still very important to do.
And Dr. Perlman, so South Korea is to start mass producing a blood plasma treatment for COVID-19 as soon as this month. Now, what does the scientific evidence tell us about convalescent plasma? Is it a safe and effective treatment for COVID-19?
I don't think we have the answer to that yet. There was a study that showed that under certain conditions it seemed to have promise, and I think there are good hints that it may work, but we don't have firm evidence that it will. It's worked in other settings. The safety issue is another issue. It's not completely resolved whether the cost-benefit ratio in terms of safety is going to be good. It really depends on how effective it is. If it's very effective, then it'll go in favor of treatment. But this is one of these treatments that's been, I think the success of its possible rate has been exaggerated. So we hope that it'll work, but we're not as far along as some people would think.
Well, I suppose authorities will have to see how it works, and well, it hasn't gone through all the phases yet of clinical trials, but fingers crossed they will. Dr. Sambanis, also here in South Korea, we're going through what many call a second wave of the coronavirus. And well, learning from the first wave, what do you think countries should really keep in mind when responding to the second wave?
Yeah, that's an excellent question. Health authorities should be testing for both flu and COVID-19 as often as possible. We cannot stress the importance of gathering and analyzing COVID-19 and flu data. Public health agencies need to identify in advance the vulnerable populations and prioritize mitigation measures to protect them. For example, most health authorities have developed like online portal to gather overall population information. But based on our recently published study, we need to separate health indicators such as living in general population and the vulnerable residents in long-term care facilities like nursing homes. As soon as cases begin to increase, we need to restrict access to these long-term care facilities like nursing homes.
So really, it's responding quickly and effectively to the virus that we really need to learn, because in the first wave, we didn't see that from many governments. And well, Dr. Perlman, we've heard some reports that COVID-19 is mutating in different parts of the world. Are COVID-19 mutations also something that scientists need to really factor in for drug design?
Right now, not. It's something we always have to pay attention to with viruses, because viruses can mutate. This virus, even though it has some abilities to not change as much as some other viruses like it, still can change. But so far, the changes that have been noticed either have not been incorporated into large populations of the virus, or if they have, they really have not changed the disease. They've not made people sicker. It's not changed the rate of transmission, really. And there's no evidence that it would affect any antiviral drug treatments or vaccines at this point. I should change that a little bit. There may be some effects on transmission, but really equivocal as to whether it matters.
So you didn't really notice I suppose, a stark difference from the evolution of different viruses, previous coronaviruses that we dealt with?
Well, we saw evolution of the original SARS coronavirus because that was a virus that went from bats to these exotic animals in Guangdong. And during that time, we could see them evolve both in the exotic animals like palm Pacific cats and Chinese ferret badgers. So we could see them evolve there. But then when they reached humans, they had to evolve again. We could see that change. This virus, this SARS-CoV-2, the one that causes COVID-19, has been remarkable because it has been so well adapted to humans from day one. So it really doesn't need to change. From the virus's point of view, it's perfect. We're very upset about having a mortality rate of 1% or 2%, whatever it's going to come down to. But from the virus point of view, that means that most people live so it can survive to infect new people, because the whole goal of a virus is to make more virus. It doesn't want to kill the host. It doesn't really want to do anything else, just to make more virus.
And Dr. Sambanis, how worried do you think we should be about the COVID-19 virus evolving?
I more or less agree with the comments that were just said. More than 6 months into the pandemic, the virus potential to evolve into a nastier direction, or if we're lucky to become more benign, is unclear. So in part, that's because it changes more slowly than most other viruses, given virologists fewer mutations to study. So all I can say as of today is that worldwide daily confirmed cases continue to increase. However, this is primarily driven by increasing cases observed in Latin America, the US, and India. So totally agree with the comments that were stated.
And Dr. Perlman, so going back to blood plasma treatments, we still, as you mentioned, don't really know the complete efficacy of these treatments, but what kind of risk could there be if things go wrong? I mean, are there any side effects that could happen?
Well, what you always worry about is giving plasma from one person to another. And sometimes you worry about infections being carried in the plasma. Sometimes there's unexpected allergic reactions. So those are the kinds of things that people have worried about in the past. In this case, we know so much more about human viruses, they seem a little less likely. But clearly, you want this to work. And the hints are that it will work for some people under some situations. So it's not like it's completely not going to work, but it may be certain populations. The other things that when we think about this treatment is it's really critical that we know how much antibody is in the plasma, because that's the part of the blood that actually is protective. And if there's not enough antibody, if the levels are too low, then it won't work, even if it could have worked. So measuring that is really an important part of the treatment. Early on, people were not measuring antibody titers that much. And so as a result, if you give just normal plasma, you're not going to have any effect. So that's one of the things we've learned. We have to know a lot about the plasma we're giving. It's also the reason that people are also intensely working on an alternative to plasma, which is to give the antibodies themselves. So if you can isolate 2 or 3 antibodies and have a potent combination of them that neutralizes the virus, and you give it early enough in the infection, then this might substitute for the convalescent plasma and make it safer and easier. And people are working on that right now. That's certainly what happened in Ebola. The best therapies turned out to be mixtures of antibodies that were effective against Ebola.
Would it be right to say that it's maybe easier, or it will be quicker to get a treatment than developing a full-fledged vaccine at the moment, Dr. Perlman?
Well, I think it just depends how fast things go, because plasma, certainly we have the facilities, and a lot of countries that have good medical facilities are able to get plasma fairly simply. In terms of vaccines, as you know from the press and all other media, there's 150, 200 vaccines out there. 5 to 10 are being tested intensely, and we will have trouble knowing in the next month or 2, which is when some people would like to have a vaccine, how well they're going to work. The vaccine trials have to be shorter than they usually are. Whether they'll be able to give us good information is still a little bit of an open question, and whether they'll be able to tell us everything we need to know about safety is also pretty uncertain. But the need is great, and unfortunately it's been so politicized that they're pushing forward with the vaccine, and we have to hope that all the people who make decisions about who should get vaccines and whether they should be licensed. And none will be licensed in the next month, I'm sure of that. But they may be given, in the US, they may be given emergency approval.
And Dr. Zambanis, as Dr. Perlman just mentioned, there is a lot of that. This issue has been so politicized, and well, in my opinion, a lot of people around the world, much of the public, have been very conflicted about the messaging that they've been getting from their governments and authorities, different authorities. So how do you think the public messaging really should be in terms of really preparing the members of public for a possible second or even third waves and going forward?
Yeah, most health authorities will base their decisions on a metric called the reproduction factor. This is how many people on average one person with the disease will infect. The basic rate of infection of COVID-19 is a theoretical number that is calculated in combination of daily real-world data and simulation models that predict the spread of the pandemic. So the disease is dynamic and affected by all these other external factors. And the one thing important to note is that most health authorities is also dependent on hospital capacity. However, without widespread testing, you risk health system to be eventually overburdened and avoidable deaths to occur. So everyone needs to be pretty cautious the way we approach this. And so mathematical models and their simulations can be used by governments to determine what interventions and policies they should implement. But simulations can measure the impact of intervention and compare it to interventions, or how the timing of the introduction affects the outcome. But also governments must make massive investments in contact tracing, which tries to stop the chain of transmission by identifying those individuals who need to self-isolate and reduce that spread of the contagion.
And Dr. Zambanis, with the flu season coming up, the weather is getting colder. How should then we protect ourselves against COVID-19 as well, especially if we're susceptible to other viruses during this time of year?
Yeah, for now, we need to continue with massive testing, and to produce reliable data is instrumental in identifying these areas that need careful surveillance. So to minimize the impact of a second wave of COVID-19, since a vaccine is currently unavailable, we can only deal with the pandemic through behavior. And the best and easiest way to do this is through physical distance of 2 meters. However, we all know that this has economic and mental health consequences, and in some cases is not feasible. So the use of masks and extensive hand washing is instrumental. Knowing most infections can occur indoors, identifying only essential employees, and reintroducing lockdown measures may need to occur, but we need to experiment with different options to reduce the probability of indoor contagions is key, because that's where most infections do occur.
And finally, before we go, Dr. Perlman, in the US, where you both are, there is a lot of talk around the possibility of a vaccine being developed by next month. Should we be optimistic or more cautious about this?
Oh, I think we should be cautious, because we won't have all the information in. The phase 3 trials will barely be done, if they're done at all. We won't have all the information we need. And the other reason to really be cautious is there's a huge fraction of people who are interested in getting vaccinated, but not interested in getting a vaccine that's not approved and not well shown to be safe and work well. And this is even true among healthcare workers, who are considered the first line to get the vaccine. I've been on these committees, and there's many of them around that are trying to prioritize who should get a vaccine when it's available. And this is a really important issue, but if people are not comfortable taking the vaccine, then all of this is really for naught. We have to be cautious about where we are. And I think the drug manufacturers who are making these know this. They've at least talked about how they weren't going to push forward if there wasn't appropriate data in hand to show that the vaccines were safe and efficacious. But we'll have to see what happens.
Well, I totally agree with you there, sir. I mean, we've talked a lot about, pushing this drug out very quickly, but perhaps not how we should do it appropriately or effectively. But I'm afraid this is where we're going to have to wrap up the discussion today. That was Dr. Stanley Perlman, Professor of Microbiology and Immunology at the University of Iowa, and Dr. Paul Zambanis, Adjunct Assistant Professor of Environmental and Occupational Health Sciences at the University of Illinois Chicago School of Public Health. Thank you both so much for joining us today.
Thank you, Siyoung.
Okay, thank you for having us.
And to our viewers, thank you for watching. We'll be back tomorrow at the same time here in South Korea. Have a great day or evening wherever you are. Goodbye.